Chronic pain is more than just a lingering ache. It's a complex, multifaceted condition that affects millions worldwide. Unlike acute pain, which serves as a biological warning signal, chronic pain persists for months or even years, often outlasting its original cause. This condition can significantly impact daily life, leading to emotional distress, reduced mobility, and a heavy burden on healthcare system. In this video, we'll unravel the latest scientific understanding of chronic pain, explore its diverse mechanisms, and discuss why a one-size-fits-all approach to treatment often falls short. We'll also introduce cutting-edge therapies and emerging concepts that could transform how we diagnose and manage chronic pain in the future. Chronic pain is a global health issue, affecting up to 40% of adults in some countries. Its prevalence varies widely, influenced by geography, demographics, and healthcare access. For example, surveys show chronic pain rates of 20% in the United States, 28% in Italy, and over 40% in the UK. Despite advances in medicine, many patients still struggle to find effective long-term relief. The burden extends beyond individuals, straining healthcare systems and economies. Understanding the scope of this problem is crucial for developing better prevention, diagnosis, and treatment strategies tailored to diverse populations. According to the International Association for the Study of Pain, chronic pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, lasting longer than 3 months. Unlike acute pain, which is protective, chronic pain often becomes maladaptive, losing its biological purpose and instead contributing to suffering and disability. This distinction is essential for clinicians and patients alike, as it shapes the approach to diagnosis and management. Recognizing chronic pain as a disease in its own right rather than just a symptom marks a major shift in medical thinking. Chronic pain is not a single entity. It encompasses 3 primary subtypes: nociceptive, neuropathic, and nociplastic pain. Nociceptive pain arises from tissue injury or inflammation, neuropathic pain results from nerve damage, and nociplastic pain is due to altered pain processing in the central nervous system without clear tissue or nerve injury. Each type involves distinct mechanisms and requires different treatment strategies. Understanding these categories helps clinicians tailor therapies to the underlying cause, moving away from the outdated one-size-fits-all approach. Nociceptive pain is the body's natural response to harmful stimuli such as injury or inflammation. It serves a protective function, alerting us to potential damage. This type of pain can be further divided into somatic pain, which originates from skin, muscles, or bones, and visceral pain, which comes from internal organs. Common examples include osteoarthritis and post-surgical pain. Nociceptive pain typically subsides as the underlying injury heals, but in some cases it can persist and become chronic, requiring targeted interventions. Neuropathic pain arises from damage or disease affecting the somatosensory nervous system. Unlike nociceptive pain, it often persists even after the initial injury has healed. Common causes include diabetes, shingles, and nerve compression. Neuropathic pain is characterized by symptoms such as burning, tingling, or electric shock-like sensations, and it can be notoriously difficult to treat. This type of pain often involves maladaptive changes in both peripheral and central nervous systems, leading to persistent hypersensitivity and spontaneous pain. Nociplastic pain is a relatively new concept describing pain that arises from altered central nervous system processing without clear evidence of tissue or nerve injury. Conditions like fibromyalgia and irritable bowel syndrome are classic examples. Patients often experience widespread, diffuse pain, fatigue, and cognitive symptoms. Mechanisms involve central sensitization, where the brain and spinal cord amplify pain signals, making even normal sensations feel painful. This type of pain challenges traditional diagnostic and treatment approaches, highlighting the need for innovative mechanism-based therapies. Peripheral sensitization refers to the increased responsiveness of sensory neurons or nociceptors at the site of injury or inflammation. When tissues are damaged, they release a mix of inflammatory mediators, sometimes called the inflammatory soup, which lower the activation threshold of nociceptors. This makes the area more sensitive to pain and can lead to ongoing discomfort even after the initial injury has healed. Peripheral sensitization is a key driver in the transition from acute to chronic pain, especially in conditions like arthritis and post-surgical pain. Central sensitization occurs when the central nervous system, especially the spinal cord and brain, becomes hyperresponsive to pain signals. This process amplifies pain, making even light touch or mild stimuli feel painful. Central sensitization is a hallmark of many chronic pain conditions, including fibromyalgia and neuropathic pain. It involves complex changes in neurotransmitter release, receptor sensitivity, and neural circuitry, leading to persistent pain even in the absence of ongoing injury. Brain is not just a passive recipient of pain signals, it actively shapes how we perceive and respond to pain. Key regions like the hippocampus, prefrontal cortex, and limbic system are involved in processing the sensory, emotional, and cognitive aspects of pain. Chronic pain can lead to structural and functional changes in these brain circuits, reinforcing pain memories and emotional distress. Understanding the brain's role is crucial for developing therapies that address not just the physical, but also the psychological dimensions of chronic pain. Chronic pain is closely linked to the body's stress response systems, particularly the hypothalamic pituitary, adrenal HPA axis and the sympatho-adrenal medullary SAM axis. Dysregulation of these systems can worsen pain by increasing inflammation, amplifying pain signals, and disrupting the body's natural pain control mechanisms. For example, chronic stress can lead to low cortisol levels and heightened sympathetic activity, both of which are common in conditions like fibromyalgia. Managing stress is therefore a key component of effective chronic pain treatment. Not everyone exposed to the same injury or illness develops chronic pain. Genetic factors play a significant role in determining susceptibility. Variations in genes related to neurotransmission, immune response, and metabolism can increase the risk of chronic pain, especially neuropathic pain. For example, certain gene variants affect how the body processes pain signals or responds to inflammation. Understanding these genetic influences can help identify individuals at higher risk and guide personalized prevention and treatment strategies. Men are more likely than men to experience chronic pain, particularly nociplastic pain conditions like fibromyalgia. Hormonal differences, immune system variations, and psychosocial factors all contribute to this disparity. Additionally, comorbidities such as diabetes, obesity, and immune compromise can increase the risk and severity of chronic pain. These conditions often interact, creating a complex web of risk factors that must be considered in both diagnosis and treatment. External factors such as physical injury, surgery, infections, and lifestyle choices like physical inactivity or poor sleep can trigger or worsen chronic pain. Environmental stressors including socioeconomic challenges and exposure to trauma also play a role. These extrinsic factors often interact with intrinsic vulnerabilities, making prevention and management a multifaceted challenge. Addressing lifestyle and environmental risks is essential for reducing the overall burden of chronic pain. Ecological and social factors are central to the experience of chronic pain. Prior pain history, exposure to stress or trauma, and psychological traits like anxiety, depression, or catastrophizing can all increase the risk of pain becoming chronic. These factors not only influence pain perception but also affect treatment outcomes. A biopsychosocial approach, addressing biological, psychological, and social dimensions, is now recognized as essential for effective chronic pain management. Accurate diagnosis of chronic pain requires identifying its underlying mechanism, nociceptive, neuropathic, or nociplastic. Clinicians use a combination of patient history, physical examination, screening questionnaires, and laboratory tests. Tools like the McGill Pain Questionnaire, DN4, and Central Sensitization Inventory help differentiate pain types. However, there is no single definitive test, and diagnosis often relies on a convergence of evidence from multiple sources. Laboratory tests and imaging can support the diagnosis of chronic pain, especially when neuropathic mechanisms are suspected. Techniques include nerve conduction studies, skin biopsies, corneal confocal microscopy, and advanced neuroimaging. While these tools can reveal structural or functional abnormalities, they are not always definitive. The search for reliable biomarkers continues, aiming to improve diagnostic accuracy and guide personalized treatment. Managing nociceptive pain typically starts with simple analgesics like acetaminophen and NSAIDs. For more severe or persistent pain, short-term use of opioids or interventional procedures may be considered. Non-pharmacological approaches such as physical therapy and psychological support are increasingly recognized as essential components of care. The goal is to address both the symptoms and the underlying cause, promoting healing and restoring function. Neuropathic pain often requires a different approach, relying on medications like gabapentinoids, tricyclic antidepressants, and SNRIs. Topical agents such as lidocaine or capsaicin patches can provide localized relief. For refractory cases, interventional procedures like nerve blocks or spinal cord stimulation may be necessary. Psychological therapies and physical rehabilitation are important adjuncts, helping patients cope with the emotional and functional impact of chronic pain. Nociplastic pain, non-pharmacological interventions are the cornerstone of treatment. Patient education, graded exercise, and psychological therapies like cognitive behavioral therapy, CBT, acceptance and commitment therapy, ACT, and mindfulness-based stress reduction, MBSR, are first-line options. Medications may play a supportive role, but opioids and conventional analgesics are generally ineffective. Multimodal, patient-centered approach is essential for managing these complex conditions. Exercise, physical therapy, and mind-body practices like yoga and tai chi can help reduce pain and improve function in chronic pain patients. Psychological therapies address the emotional and cognitive aspects of pain, teaching coping skills and promoting resilience. Combining these approaches in a personalized plan offers the best chance for long-term relief and improved quality of life. Cold atmospheric plasma (CAP) is an innovative therapy generating reactive oxygen and nitrogen species at near ambient temperatures. CAP has shown promise in promoting tissue healing, reducing inflammation, and even targeting nerve regeneration. Early studies suggest it may help relieve nociceptive, neuropathic, and cancer-related pain by addressing the underlying biological mechanisms. While still experimental, CAP represents a potential breakthrough in personalized pain medicine. CAP works through multiple mechanisms. It can suppress pro-inflammatory cytokines, promote cellular regeneration, and enhance drug delivery through the skin. In neuropathic pain, CAP may stimulate nerve repair by activating specific molecular pathways. In cancer-related pain, it can help shrink tumors and reduce inflammation. CAP's ability to modulate metabolic and hormonal pathways also suggests potential benefits for obesity and gender-related pain syndrome. While CAP has demonstrated promising results in preclinical and early clinical studies, several challenges remain before it can be widely adopted. Its limited tissue penetration, the need for precise dosing, and the lack of large-scale clinical trials are key hurdles. Researchers are exploring new delivery methods such as injectable formulations and hydrogels to expand CAP's therapeutic reach. Ongoing studies aim to validate its safety and effectiveness across different pain conditions. Novel hypothesis suggests that the hippocampus, a brain region known for memory and spatial navigation, may act as a central sensor for nociplastic pain. Unlike nociceptors, which detect physical injury, the hippocampus might process higher dimensional information related to pain perception, emotion, and memory. This model could explain why nociplastic pain often involves widespread symptoms, emotional distress, and cognitive dysfunction, and may open new avenues for diagnosis and treatment. Research shows that chronic pain can lead to structural and functional changes in the hippocampus, including reduced volume and altered connectivity. These changes are linked to cognitive and emotional symptoms commonly seen in nociplastic pain. The hypothalamus, another key brain region, integrates these signals and coordinates physiological and emotional responses. While the hippocampal model is still theoretical, it highlights the importance of central nervous system mechanisms in chronic pain. Despite exciting advances, translating new concepts like CAP therapy and the hippocampal pain model into clinical practice faces significant challenges. For CAP, issues include optimizing delivery, dosing, and proving efficacy in large trials. For the hippocampal model, establishing causality and developing reliable biomarkers are key hurdles. Overcoming these barriers will require interdisciplinary research collaboration and a commitment to patient-centered innovation. Future of chronic pain management lies in precision medicine, tailoring diagnosis and treatment to each patient's unique biological, psychological, and social profile. Advances in genetics, neuroimaging, and biomarker research are paving the way for more accurate pain classification and targeted therapies. Integrating these tools with patient-centered care promises to improve outcomes and reduce the burden of chronic pain worldwide. A single therapy can address all aspects of chronic pain. A multimodal approach, combining pharmacological, physical, psychological, and interventional treatments, offers the best chance for meaningful relief. This strategy recognizes the complex, interconnected nature of chronic pain and emphasizes collaboration among healthcare providers, patients, and families. Ongoing research continues to refine these approaches, aiming for safer, more effective, and more personalized solutions. Chronic pain remains one of the most challenging medical conditions, but advances in science and medicine are bringing new hope. By embracing mechanism-based diagnosis, innovative therapies like CAP, and a holistic, patient-centered approach, we can move beyond symptom management toward true healing. The journey is ongoing, but with continued research, collaboration, and compassion, the future of chronic pain care looks brighter than ever.